everyone. I hope you all will be safe and sound. Today we'll be discussing about nosebleed. Nosebleed is the loss of blood from the tissue that lines the inside of our nose. Nosebleeds are also called epistaxis. They are most common. Some 60% of people will have at least one nosebleed in their lifetime. The location of the nose in the middle of the face and the large number of blood vessels close to the surface in the lining of our nose make it an easy target for injury and nosebleeds. Although seeing blood coming out of our nose can be alarming, most nosebleeds are not serious and they can be managed at home. However, they should be checked by our doctor. For instance, if you have frequent nosebleeds, you should see your doctor. This could be an early sign of other medical problems that needs to be investigated. A few nosebleeds start in the back of the nose. These nosebleeds usually involve large blood vessels, resulting in heavy bleeding, and they can be dangerous. They need medical attention for this type of bleed, especially if the bleeding occurs after an injury and the bleeding hasn't stopped after 20 minutes of applying direct pressure to your nose. So let's talk about nose bleeding in detail. There are two main types. One is more serious than the other. Anterior nose bleeding and posterior nose bleeding are the two main types of nose bleeding. Anterior nosebleed starts in the front of the nose on the lower part of the wall that separates the two sides of the nose, called the septum. Capillaries and small blood vessels in this front area of the nose are fragile and they can easily break and bleed. This is the most common type of nosebleed and is usually not serious. These nosebleeds are more common in children and are usually able to be treated at home. While posterior nosebleed occurs deep inside the nose, this nosebleed is caused by a bleed in larger blood vessels in the back part of the nose near the throat. This can be more serious nosebleed than an interior nosebleed. It can result in heavy bleeding which may flow down the back of the throat. You may need medical attention right away for this type of nosebleed. This type of nosebleed is more common in adults. Anyone can get a nosebleed. Most people will have at least one in their lifetime. However, there are people who are more likely to have a nosebleed. They include children, adults, pregnant women, people who are taking blood thinning drugs, and people who have blood clotting disorders. So children between ages 2 and 10, they can get nosebleed because of dry air, colds, allergies, and sticking fingers and objects into their nose make children more prone to nosebleeds. Adults between ages 45 and 65 can also get nosebleeds that may take longer to clot in midlife and older adults. They are also more likely to be taking blood thinning drugs such as aspirin, or they have high blood pressure, or atherosclerosis, which means hardening of the walls of arteries, or a bleeding disorder. In pregnant women, blood vessels in the nose expand while they are pregnant, which puts more pressure on the delicate blood vessels in the lining of the nose. People who are taking blood thinning drugs such as aspirin or warfarin, they can also get nosebleeds. And lastly, people who have blood clotting disorders such as hemophilia or von Willebrand disease, they can get nose bleeding. The most common cause of nosebleed is dry air. Dry air can be caused by hot, low humidity climates or heated indoor air. Both environments cause the nasal membrane to dry out and become crusty or cracked, and more likely to bleed when rubbed or picked or when blowing your nose. Other common causes of nose bleeding include nose picking, colds, and sinusitis, especially episodes that cause repeated sneezing, coughing and nose blowing, blowing your nose with force, inserting an object into your nose, injury to the nose or face, allergic and non-allergic rhinitis, that means inflammation of the nasal lining. If you are taking blood thinning drugs like aspirin or inflammatory drugs like warfarin and others, if you are addicted to cocaine and other drugs that you are inhaling through nose, chemical irritants, especially in cleaning supplies, chemical fumes at workplace or other strong odors, or high altitudes can also cause nosebleed because the air is thinner over there and lack of oxygen is there and drier as the altitude increases. So it can also cause nose bleeding. Other less common causes of nose bleeding include alcohol use, bleeding disorders such as hemophilia or leukemia, if you are having high blood pressure, if you have done facial and nasal surgery, if you are having nasal tumors, or if you are going through pregnancy. By following these steps, you can easily stop nose bleeding at home. First of all, you need to relax. Next, you should sit upright and lean your body and your head slightly forward. This will keep the blood from running down your throat, which can cause nausea, vomiting, or diarrhea. Breathe through your mouth. Use a tissue or damp washcloth to catch the blood. Next, you should use your thumb and index finger to pinch together the soft part of your nose. Make sure to pinch the soft part of the nose against the hard bony ridge that forms the bridge of the nose. Squeezing at or above the bony part of the nose will not put pressure where it can help stop the bleeding. Keep pinching your nose. If your nose is still bleeding, continue squeezing the nose for another 10 minutes. If you would like, apply an ice pack to the bridge of your nose to further help constrict blood vessels, which will slow the bleeding and provide comfort. But you can also try this if you want. You can spray and by following these steps, your bleeding will stop. But please do not bend over, strain, or lift anything heavy. Do not blow or rub your nose. Call your doctor immediately if you cannot stop the bleeding after more than 15 to 20 minutes by applying direct pressure on your nose. If the bleeding is rapid or the blood loss is large, if you are having difficulty breathing, if you have vomited because you have swallowed a large amount of blood, if your nose bleeding has followed a blow to your head or serious injury, or you can call your doctor soon if you get your nose bleeds often, if you have symptoms of anemia, if you are having a child under 2 years of age who has had a nosebleed, if you are taking blood thinning drugs or have a blood clotting disorder and the bleeding won't stop. So you should not take any risk and directly call your doctor, or you should visit your doctor. If you get a nosebleed that seems to have occurred with the start of a new medication, if you have nose bleeding as well as notice unusual bruising all over your body, this combination may indicate a more serious condition such as a blood clotting disorder that is called as hemophilia or von Willebrand disease, or you are having leukemia or nasal tumor, so you will need to be checked by your doctor. The reason for nose bleeding during sleep are the same as the reasons why they occur during the daytime. That is the dried nasal membrane, which is caused by dry air, allergies, and colds and other upper respiratory infections that damage the delicate nasal membrane lining your nose. Sleeping with your head to the side also may put direct pressure on the nasal cavity and may be another reason for nosebleeds at night. Or if you blow your nose frequently or blow with force, you can damage the delicate blood vessels in your nose that cause them to bleed. As far as the home remedy is concerned, I'll be sharing a very easy home remedy that includes only two ingredients. One is alum stone, which is also called pitkari in Urdu. Just make it into a fine powder and take half teaspoon of pitkari or alum stone, and the next ingredient is water. Just mix them. You can take almost like 1/4 part of water and half teaspoon of alum stone. Just mix them thoroughly and put them in, preserve them in some dropper bottle. And whenever you are feeling this nose bleeding, you are going through this condition, you just put 2 drops in your each nostril, and next time you will not have this nose bleeding again. Thanks for watching. Please like, comment, share and subscribe my channel.